Overheard. My sister's boyfriend was doing a gynecology rotation during med school. One day he had to examine a woman with concerning symptoms. From sight and smell alone, he was almost certain it was cervical cancer. He was upset. He'd never had to tell someone they might be dying. This was the first time he truly felt the weight of it. The atmosphere in the room was heavy, silent. The staff prepared for the worst. And they took a closer look. What they thought was a tumor was actually a tampon. A tampon that had been left in there for so long it had swollen, decayed, and started fusing with tissue. It looked exactly like cancer. The relief, immense. It wasn't cancer, just a horrifying case of a forgotten object, and a very lucky escape. Not a gynecologist, but a couple years back I went in for my annual exam, and they discovered I had a second, smallish, sneaky sort of vagina. Apparently this isn't that common, and so of course Perfectin, the doctor, asked if a few medical students could observe, and by a few I mean all of them. And of course every single one happened to be male. At some point I just gave up emotionally and thought to myself, wow, it's like a party all for my vaginas. My wife is an obstetrician gynecologist who specializes in maternal fetal medicine, which basically means she works with high-risk pregnancies and complications. One day she had a patient, an obese woman with diabetes, who came in with what turned out to be a large abscess on her labia. It was about the size of a lemon. When they lanced it, the abscess exploded. It missed my wife, but it hit the nurse. My wife later said the smell was worse than 1,000 decaying bodies. And the nurse, who had over 10 years of experience, threw up all over the exam room. To this day, my wife says it's one of the most disgusting moments of her entire medical career. Ex-girlfriend's dad used to work in the medical field before he retired to follow. He once told me about the worst case he ever encountered. It involved a woman who was addicted to heroin. Over time, her veins had become so damaged that she started looking for alternative places to inject. And for some reason, she decided her labia were a good option. She kept injecting there over and over again. Eventually, the tissue went completely gangrenous. By the time she came in for treatment, everything was black, rotting, and beyond saving. Even the most experienced staff were horrified by what they saw. I worked as a medical assistant in a gyno office, and the worst patient we ever had was actually really sad. She clearly hadn't bathed in about a week and her underwear were stained. She claimed she was having trouble getting pregnant and had a bunch of eggs frozen and wanted a pelvic exam. The smell when she took her pants off was horrific. I'm fairly certain she had mental problems because she proceeded to tell me that she knew how to kill a man and get away with it, and could help me out if I ever needed it. I was doing clinicals at a large inner city clinic attached to a hospital. The first patient of the day was a woman in her 50s who had recently had a vaginectomy. To try and combat vaginal cancer, they had gone and removed her entire vagina. I've never seen anything like it. After we removed the packing, it was just a huge, gaping, dripping maw in between her legs. There was absolutely nothing left of her female anatomy. The worst part was how terrible she felt about the whole thing. She refused to let her husband see anything and was in tears the entire time, telling him he should go. She doesn't deserve to have him now. For the most part, he just cried, attempted to hold her hand, and told her he loved her and could never leave. One of the strangest things I ever heard from a colleague was about a woman who came into the clinic complaining of an intense smell and skin irritation. She was severely obese, and during the exam, they discovered something lodged deep between the folds of her skin. It turned out she had been placing pieces of bread between the folds to absorb sweat. At some point, she had forgotten one of the slices, and it had stayed there for weeks. By the time they found it, the bread had turned into a soggy greenish lump, soaked in sweat and body fluids. The smell was absolutely overwhelming. Even the nurses, who were used to all kinds of things, had to leave the room. One of them nearly threw up. Nobody could believe what they were seeing. I removed a sex toy from a woman's vagina that had been there for over 2 months. She came in with abdominal pain and an awful smell. The device was completely black and covered in dried tissue. She claimed she forgot it was there. During a routine gynecological exam, I had one of the most uncomfortable experiences of my life. Everything was going fine until the doctor paused during the pelvic part of the exam, looked me dead in the eye, and said, "Do you masturbate often? I can usually tell by the way things look down here." I froze. I had no idea how to respond to that. It wasn't a medical question. It wasn't part of any history taking. It felt creepy and violating. The worst part, he said it so casually, like he was commenting on the weather. I got out of that office as fast as I could and never went back. To this day, I still get nervous every time I schedule an appointment. I went in for a routine gynecological exam at 19. I'd filled out my intake form honestly. I've never been sexually active. The nurse and doctor both reacted. You could tell they didn't believe me. They asked me rude, demeaning questions in the hallway, in the exam room. They even joked I was lying. One doctor said, "Are you sure you've never been intimate?" With a smirk. I was humiliated. I felt like they thought I was naive or even pretending. That exam left me nervous for years afterward. I still think about that feeling that my body was judged instead of respected. My dad is a gynecologist and told me this story. He treated a girl that had trick, green foamy discharge, who had it for months before coming in. He told her to take the medicine right away and continue it completely. A few weeks later, she comes back in and she still had the green foamy discharge. My dad asked why she stopped taking the medicine and she said, "Well, my boyfriend really loves the taste." I used to work for a urologist, and one night he was on call for the local hospital, and a morbidly obese woman came in with painful urination. They decided to put her under anesthesia and do a cystoscope. Once they had her on the table, the doctor spread her legs. He said the first thing that hit him was the smell. It was atrocious. He went on to find what looked to be a smashed and rotted sandwich in the folds of her buttocks and thigh area. Once the patient woke up from the procedure, he asked her about it, and her reply was, "Oh yes, I did lose a sandwich a couple of weeks ago. I just thought I ate it and forgot." As a medical student, I had to do a pelvic exam on a morbidly obese lady who thought she was labor. After several attempts, I just could not get an accurate view with the speculum due to the sheer size of this lady. As such, I had to call my resident in for help. As the resident attempted to do a speculum exam on this patient, her first couple of attempts were unsuccessful as mine had been. However, on her third attempt, she was able to pass a speculum into the vagina cavity. Then the patient all of a sudden started screaming really loudly. We weren't really sure what had happened, but upon closer inspection, the woman's pannus, or her belly fat, had become caught on top of the speculum and had actually gone inside the vaginal cavity. So in essence, her belly went inside her vagina. That is definitely the grossest gynecological thing I have ever seen. Not a gynecologist, but I've wanted to share this. 3 or 4 years ago, my buddy in college was finger banging a girl and literally pulled a used condom out of her vagina. The worst part is the girl didn't even notice, so he just stuffed it back in there and said he had to leave. I had a cyst near my vagina that got so big I could barely walk. They had to cut it open to drain it, but instead of flowing out, the pus squirted straight onto my gynecologist's face. This isn't about my gynecologist, but a nurse practitioner taking my routine smear test. It's also more funny than horrifying. Routine screening starts at 25 in the UK, and unless abnormalities are seen, are done every 3 years. I had abnormalities on my first smear, so I racked up more cervical inspections than most. It's all fine now, and therefore was completely comfortable in knowing what to expect from the experience by the time I turned 31. So when the nurse practitioner was taking absolutely ages about it, I started getting slightly uncomfortable and curious. She was re-angling lights as she stared into my fanny, trying a variety of different speculum. Eventually, she called in a colleague and they whispered and prodded down by my spotlit genitals as I got more and more concerned until the original nurse stood up and quietly addressed me. I was informed that my arse was too small to be creating the normal angle for investigating the cervix, and please would I ball my fists under my bum cheeks to create a clear visual passage for them. I meekly complied, but I mean, I always knew I had the world's flattest arse, but now I had it medically confirmed just how insubstantial it was. Another story concerns the gynecologist that saw me when I was dealing with the aforementioned abnormalities. He was an eminent and respected man of his field that had been around long enough that my mother had been his patient before having children and for a while after. He had been around during her pregnancy with me, my birth a trimester early, and all the drama that accompanied it. I have a bit of a problem with not thinking before I speak, so when I was leaving and he told me how much I looked like my mom, I couldn't stop myself from asking which end. To his credit, he just laughed and saw me out the door. My gynecologist's hand was already inside of me when he exclaimed, "Wait, I know where I recognize you from." He realized that I was a waitress at the breakfast spot he went to with his family every week. Never came in after that. Heard this story secondhand from a bunch of doctors telling gross stories. So this woman comes into the ER complaining about pain in her vagina. So the doctor reaches in and pulls out an empty Doritos bag. Apparently she was a prostitute and the guy just didn't have a condom on him, so he wrapped a used Doritos bag around his dick and dived in. My mother is a gynecologist, and while I don't recall any nasty stories, I do remember a very peculiar case. A young girl had an appointment because she hadn't gotten her first period yet, and she was well into her teen. My mom ordered a hormone test, and when the male doctor who performed the test called her, he said, "She has testosterone levels I'd be proud of." Turns out this girl was biologically male. Kinda. Her body didn't respond to testosterone, so she never developed any male features. Apparently, it's an extremely rare condition. One night while on call, I got a page for a vague general surgery case. Nothing unusual for a town full of young military guys and meth addicts. I arrived at the hospital and learned it was a perirectal abscess, an infected pocket near the anus. Lovely! I went to pick up the patient from the ER. The nurse just handed me the chart and said, "Have fun with this one." Bad sign. The patient was a 314-pound Native American woman, moaning, thrashing, and mumbling Hail Marys. She could barely answer basic questions. Her chart noted she had been injecting IV drugs into her perineum, which likely caused the infection. We got her to the OR. She nearly fell off the table while being sedated. The team, all experienced veterans, trauma nurses, ex-Army surgeon, anesthesiologist trained in a level 1 trauma center. We thought we'd seen it all. Then the surgeon made a tiny incision, and hell exploded. A sudden muscle twitch sent a pressurized geyser of pus, fecal matter, and dead tissue blasting out of her. It shot across the room, reaching walls 7 feet away. This wasn't an abscess. It was a cavernous, festering tunnel nearly a foot deep. We were all in full PPE, gowns, gloves, face shields, but it didn't matter. The fluid hit shoes, walls, masks, and soaked into everything. One nurse started retching into her mask, then bolted out of the OR. I was 12 feet away, mouth open in shock, just as the smell hit. The anesthesiologist dropped next, gagging, throwing open the doors. More fluid sprayed out with every breath from the ventilator. I ran to grab the sacred peppermint oil every OR has for masking horrid smells, only to find an empty goddamn box. Some monster had used the last drop and not replaced it. Desperate, I found Mastisol, medical adhesive. Not peppermint, but better than nothing. I smeared it inside my mask. The anesthesiologist followed. Turns out huffing it gives you a light high. Probably the only reason we made it through. The smell had now reached the front desk, 40 feet away. One nurse sat with bloodshot eyes, still dry heaving. The OR looked like the slime river from Ghostbusters 2, but dirtier. I went back in. I couldn't leave the surgeon alone. He stood ankle deep in brown sludge, scraping out rotting tissue. We said nothing for 10 straight minutes. I helped pack the wound with gauze, taped her cheeks closed, and got her to recovery. Then came the alcohol shower, 70% isopropyl, 5 bottles worth, to get the stench out. Honestly, that night might be the only time I'd recommend drinking some. The next morning, the entire surgical floor still reeked. Housekeeping said it took them an hour to vacuum up all the sludge. The OR was quarantined for 2 days to air it out. So now, when new nurses talk about the worst thing they've seen, I laugh. You ain't seen shit, kid. That was all for today. Share your stories in the comments and we will definitely answer you. Don't forget to like this video, subscribe to the channel, and click the bell. See you in the next video. Your team overheard.